Hello everybody, and welcome back to Hyperbaric Plus, our Facebook Live we do each week. And our regular attendee is Keith Bishop with Prevail Over Cancer.com. That Hyperbaric Plus, that's actually hyperbaric.plus. It's a new URL, and it happened to be the same as our name. And my web developer said, why not? I think he tried to talk me out of it, but I said, no, we're going to do it. So anyway, welcome everybody back to our session this week, which we're going to be talking about red light therapy and cancer. And the reason this all came up is we recently became an affiliate with Platinum LED, and we now have red light therapy here in our office. Next week we'll probably start letting people book for it. But if you come in and try it out and you like what it is, there's a discount involved if you buy through our website, and then we make a little commission. And that's what we're going to use to build out the rest of our system. We got a starter system today. So red light therapy is absolutely beneficial. If people haven't heard about it, they need to. If you have heard about it and you're practicing with red light therapy, it's incredible, and we'd like to get some comments of what you're getting out of red light therapy during our Facebook Live today, so we can share it with other people what their benefits are. So please comment. Don't hesitate to comment, good, bad, whatever you've had with red light therapy. So with all that being said, Mr. Keith, take it away.
Okay, sure. Thank you. So thank you, Paul. And we have a handout that we passed out at the table, and then also it's available at the pass that around again, okay? Also, it's available on our websites at hyperbarics.plus, resources, and then a cancer tab, is that right, or link? Okay, and then also on my website, the Learning Center at prevailovercancer.com. And so red light therapy is a very interesting, type thing that, we are exposed to different colors of literally the rainbow or sunlight with many different colors, and researchers have found that certain colors have certain effects on the body, and part of that comes from the sun, and being outside is very important, and actually putting sunscreens on can decrease some of these exposures to some of these beneficial rays that we have in our body.
Is it true that some of those sunscreens are actually chemicals?
Okay,
that we may not really want to splash all over our body?
So those sunscreens are, I don't use them anymore. I have in the past, yes, before we knew, and so now I go with more like if I have to put something on, it's going to be a zinc barrier type sunscreen. And to be a safer one, Josh is here for a little bit today, so he had an experience.
Zinc oxide is definitely it, but you want to stay away from nanotized zinc, which is on the sprays, because it gets in your bloodstream. Okay. I used a natural sunscreen that was tallow based.
Okay, a tallow. Okay.
And it was. I'll find it here in a second.
So while he's looking that up. So now, what was the spray thing that you're concerned about?
There's been a lot of research on, I was looking for natural sunscreens that are non-toxic. So as I went through that search, I found a brand that actually makes an edible sunscreen.
Oh, okay, edible.
Okay. But I was looking at it because it was safe. But when you look in the ingredients that are in most of the sunscreens, most of them have nanotized zinc oxide in them, and zinc oxide is the best at keeping the sun from penetrating, but when they nanotize it, it causes it to get into your bloodstream, and it will help carry the other chemicals that are in the sunscreen. So I was looking something that was purely natural, that worked, and the SPF factor in my case, whether it was misapplied the first time or not, but I put the 50 on my head, which is devoid of a lot of hair and no issues whatsoever, and covered the rest of my body with the 30, and I got my dose of D3 real quick.
Okay, yeah. So that's a good point. So we probably, what we put on our skin should be things that we'd be willing to put in our mouth. And so if you're putting something on your skin, makeup, perfume, whatever, and you're not willing to put it, in your mouth, maybe we should not be doing that.
Laundry detergent.
And laundry detergent, soaps, dishwashing soaps, and there's a lot of things. And so we're blessed with that knowledge, and so it's not like we have to panic and make a change on everything, but we need to pick out, okay, one item, okay, what I need to do on, let's say, soap or sunscreen. Now, in North America, going out in the sunshine a lot more, what do I need to do to make that change? So make one little change. So I'm going to provide more information about red light therapy, and actually, since cancer is my focus, I'm going to kind of lean toward that, but actually, and Paul doesn't know this, but we're going to actually kind of shift to him a little bit more to give actually probably a little bit more of a background about it. You feel comfortable about sharing a little bit more about it?
No, I will do my best. I am brand new having it here.
Okay.
I've looked at it for a long time. I'm somewhat knowledgeable. So anyway.
Okay, yeah.
We'll
So there's a certain wavelength. Matter of fact, I love watching veterinarian shows on TV, reality shows on TV. And for years, veterinarians have been using laser therapies after surgery on the animals, and it's like, and I told my wife, why do they do that, and why aren't we doing that on humans? And so there is actually research behind it, and so these therapies do have some benefits. And so, and I'm going to go through this handout, just kind of make sure I cover everything correctly. So the red light therapy is a non-invasive type treatment. It's a low wavelength, and the main purpose of it is that it helps stimulate cell function and mitochondrial function, and meaning the mitochondria are going to function better, have more energy. So while I have a tendency to concentrate on cancer, I do have a blog post that also goes into more detail of this, but actually many different health conditions, can benefit from this, because what cells need energy, or what organs rather, and cells need energy, but a lot of that actually has to do with the brain function. And so there's quite a bit of research going on in Alzheimer's and Parkinson's and neurologic diseases and such. So Josh, did you have something to share about the sunscreen thing?
Oh, I was just going to share. It was called Sun and Sky.
Sun and Sky was the brand that you used.
But
Okay.
it was made of natural ingredients and reef safe and all the rest. But human safe. You can eat it. It's all organic. And I was looking at stuff that wouldn't cause other issues.
So the nano thing, what he's talking about in the nano is where they process items to a nano, meaning small. Nano is actually going to be absorbed. And actually, even in cancer treatments, that's a major treatment research area where they will take nano, zinc, and copper and other nutrients and use them as drivers to get nutrients and chemotherapy drugs, various different things, into the tumors, into the body, into the tumors. So nano, I was not aware of a potential nano issue on the skin of the zinc being a problem. So, but it would help drive things into the body. If there's bad things in that sunscreen, it's going to help drive it into the body. So that makes sense, with that. So originally, these red light therapies are used to help with wound healing, like I mentioned about the veterinarians using them after surgeries, for skin health, pain, inflammation reduction, brain function, and even cancer therapy that we're going to be talking about. So how does it work? So it helps the mitochondria to function better and increase ATP production. That means energy production. The mitochondria in the cells, they make energy. We can exercise, we can provide basic nutrients, and so this is another way to get a little bit more in. And excuse me a second, I have an eyelash issue. That's embarrassing on camera. So, I think I got it there. Okay. And so it helps with tissue repair and helps to reduce and decrease oxidative damage. Oxidative damage is where we'll use an example, you cut an apple in half, or white potato, you cut it in half, set it on the counter. Within minutes, it's turning brown because there's not enough antioxidants in it to repair that flesh. Our body is the same way, and our cells, our organs, we have to have those antioxidants from the darker color fruits and vegetables. So you sprinkle lemon juice or citric acid, or lemon juice rather, which is vitamin C, and fruit fresh is vitamin C. You put that on the fruit and vegetables, and it won't turn dark for a long period of time. So that's what antioxidants do. Well, this helps reduce some of that issue. And now they're using it in what's called photodynamic therapy, or PDT. And actually, there's a lot of research about this in cancer treatments. So they're actually, using this treatment, during surgeries. And they're trying to figure out what do we need to do to help get this red light therapy, into the body. So that's one thing that we need to talk about. So that it only penetrates the body a few millimeters, a small distance, and so therefore it is more difficult to get that light deep into the organs. And so what they're doing is that they will actually, during surgery, they will use red light therapy during the surgeries, and they're trying to figure that out, how to do that. Of course, they're trying to also get patents and medical treatment, insurance, Medicare coverage, for that process. So they're trying to come up with methods that they can get a patent and have a good return on their investment. But we can still read about that and look at what they're doing. But even applying this, to the skin can have whole body effects to a certain extent. That research is not well developed, but it only goes into the skin up to about 8 or 9 millimeters, I believe, typically. And there's different types of red light therapy too. So some of them actually do penetrate better. Was it near that penetrates better? Near or far? Yeah, there's several different spectrums of that. And there's some of these devices, like, here's and I don't have to admit, I don't know anything about this particular product, but some of them actually have different types of lights in it. And so they have different types of red light. And some of them actually you can see the red light, and some of them you can't see the red light. So yes.
We actually have had that since 2019, and it has helped my back immensely, and helps us sleep.
Okay, so you're using that at home?
That exact thing.
Same thing. Okay, yeah. So a gentleman here is using it for his back. He's got back problems and disc problems, and so he's using it to help out with pain management. Yes. So it definitely can help out with that. So the other area that they're looking at actually in cancer is this combining it with photosensitizing chemicals. And so they're adding other chemicals into the body. We're going to talk a little bit more about that. But other chemicals in that cancer treatment. So they'll actually may even use, and I'll just go ahead and mention it, but they'll use chemicals like methylene blue during surgery to identify where the cancer is. And if that starts, that dye, the cancer cells take up these dyes. There's also other chemicals that are called lectins that will attach to those cancer cells. They'll glow in a way, if you think of it, with these lights, and then they'll actually do some treatments with that. So once again, they're trying to come up with some treatment programs that they can get the patents on and get that return on their investment. But they're using photosensitizing. That means that certain chemicals can actually become more active when they're hit with this red light. And those chemicals are a wide range of things. And so I will come back to that. I'll go through my list. It's easy for me to get kind of excited talking about these things. So when we think about the light therapy, definitely penetrates 8 or 9 into the skin. So therefore, skin cancers are a definite area that they're looking at for treatment. And so it's easy to do an exposure to the body with a light source like this on the skin. So skin cancers, esophageal cancer, lung cancer, and lymphomas are just a few things that they have definitely been testing. And I didn't mention a lot of other cancers because there's not a lot of other research. That doesn't mean it won't help, but that's the only ones that they've tested. Matter of fact, I did not find any research saying that red light would not help. But there's only certain cancers that I found that they've tested so far. So they're activating chemicals in the body, and so and what they're noticing is a reduced tumor size when they do this, and then also enhance immune response. So the immune cells actually require energy, and they like that energy, and so it ramps up the immune system as part of that immune response. Natural chemicals that can help out. And so, well, I'll talk about natural things first. And so they've only studied a few chemicals, natural products. Well, let me backstep first before I forget. There's also potential concern about exposure to other chemicals. For example, sunscreens, prescription drugs, and other things and chemicals that could be in our diet, our environment. Is a possibility that those can be in our body and in our skin. And with a red light therapy, there's a slight risk of a reaction to that. So I do recommend starting out with go low and slow. Start out with just a few minutes to see what happens. I've actually known women that were taking birth control pills, go out into the sunshine and get a horrible rash on sunshine exposure because of birth control pills. So, and I can't say, well, exactly what those chemicals were, except for they were synthetic hormones. They weren't natural hormones. Those were synthetic hormones. So synthetic chemicals might be a concern. So we want to kind of go low and slow. Start out with a few minutes and gradually increase that exposure time to make sure that you can tolerate it okay on that. So same thing no matter what that is. So now we're going to talk about other chemicals, and like curcumin, one of my favorite spices, and curcumin coming from turmeric, and it also is photosensitized, and it helps the light to work better. The light helps it to work better, and part of that even is even increased cancer cell damage. So curcumin can help keep cancer cells from growing, and the light hits it. It actually creates a little physical interaction, and actually that's where that birth control pill in the sunlight happens, and actually creates almost like a little bit of a burn. There's physics, involved in that.
Yeah, it'll actually, some cells it's reparative, some cells it's
Yes.
degenerative, and so using those chemicals, specifically targeting cancer cells, it's actually attacking them.
Yes, that's right.
Preferentially.
Exactly. So it's kind of it's amazing how a lot of natural products that we have that God has given us that it's great for healthy cells and bad for cancer cells.
Yeah.
It is amazing how that works. And the same thing with even this treatment. It has a tendency to help these products to work better, but it doesn't harm the body. I'd say, and I'll qualify that. I think we still need to be cautious and kind of gradually increase that exposure time to that. And so curcumin is one of those. Acts as a photosensitizer for curcumin, and it actually generates oxidative damage in the cancer cells. So, and it seems to target those cancer cells. Resveratrol, another one of the favorite type things. So that's an active ingredient. We think of wine. It's actually in many other foods, but red wine does have that in there. But it increases oxidative stress and apoptosis, natural cancer death, when combining those type items. And then the other natural product that I found with short research is EGCG from green tea. So green tea, matcha is even stronger, many times stronger than green tea, and then concentrates of EGCG. And it actually, once again, creates that oxidative stress. And just once again, from my understanding, actually from back in the 80s, when I discovered, actually, there's other drugs that would create this sun sensitivity issue too. Sulfur drugs, so antibiotics for infections, or like urinary tract infections, but even they use sulfur drugs for skin infections. And so that can also react with the sunshine. Actually, I took an antibiotic like that once.
Antibiotic once, and then I went suntanny, and I turned purple.
You turned purple
It
from,
was very blue.
very blue from that. Okay,
Yeah, it was weird.
a Smurf,
Yeah, it was. I was like, I'm darker than normal, and it was bluish.
bluish color. Yes. So there can be some interactions with these. Now, the red light has not been known to be as much of a concern. The sunlight that I'm talking about, there's many other different types of things that can interact and different wavelengths involved. And so these are typically more focused and not as much of a concern, but still I'd be just extra cautious, with that. And then there's another, chemical that's often used, with this. I mentioned that earlier about during surgeries, using things like methylene blue. So methylene blue, does attach to cancer cells. It does also have some other benefits for energy, for brain function, alertness, in the body. But combining it, same type of a thing. It enhances mitochondrial function by combining the both of them. Now, Josh has a few more comments about this.
It actually will cause healthy ATP production even in a metabolically dysfunctional body. So it will bypass the normal switches and cause your mitochondria to generate.
Talking about the methylene blue.
Methylene blue,
Mm-hmm.
yeah. And there's a fair amount of research out now on Alzheimer's and methylene blue and some of the other neurological functions of it, notwithstanding that it was originally used as a stain for
Right.
diagnosis, but it's got a lot of other benefits.
Okay, so the definitely methylene blue, along with the red light, actually both of them, and then you combine them, we expect enhanced benefits, but neuroprotection, cognitive function improvement, and also cancer therapy are going to be the three major areas for red light therapy. The methylene blue absorbs the red light even and helps to generate that oxidative damage inside the cancer cells. Same thing as even some of the other herbal type items. And so oxidative damage is that accelerated damage to the body. And then also, in my mind too, that's going to be the perfect time to be also taking immune system support items to ramp up the immune system. Beta glucans, the mushroom type products and those extracts that contain the beta glucans, are going to be part of that, along with other nutrients to build up the immune system responses. So the potential concerns about red light therapy, are going to be overexposure, potentially redness and irritation. That is rare, but we want to be extra cautious about that. Eye safety. Usually most people are wearing glasses, or a shield over their eyes just to kind of protect that. And then skin sensitivity, because there's actually so many different things that we're exposed to in our foods, in our lifestyle, our environment.
Seed oils.
Seed oils. There's a lot of things we just don't know. Mm-hmm. So we just want to be a little bit extra cautious about that.
I would say too, when you're, if you introduce methylene blue, be cognizant of other things you shouldn't be taking. So if you're on an SSRI for
Yes.
depression, you don't want to be doing a risk of serotonin syndrome.
Right.
And there are certain antibiotics and then opioids that you shouldn't take in combination
Mm-hmm.
with methylene blue.
Okay, yeah, so methylene blue, a potential issue with serotonin syndrome, increased heart rate, blood pressure, and even with serotonin being high, it could be diarrhea. So various different things can happen with that serotonin syndrome. And then I do have more information. I have a blog post also going into those potential issues, about methylene blue. And then, I have on the sheet about burns and blisters. That comes back to that chemical interaction with chemicals that are going to be in our body. Once again, I don't expect that to be an issue with red light, but we just want to be extra cautious and slowly increase that. Just make sure that there's not something about your body and your environment, that's going to create a problem about that. So, Paul, did you have anything that you wanted to share about it?
So I started researching red light therapy. Well, I didn't want to know. Hi, everybody. I didn't know that was going to happen.
People don't know who you are.
Yeah, here we go. So I started researching red light therapy a long time ago because I just thought it would be synergistic to what we're doing with hyperbarics. Everything we do here is synergistic value to hyperbarics. So as I got into it, I finally made a decision. This is the panel I'm going to use, and it was platinum. And by using the platinum panel, I pretty much latched onto that, and I said, well, I wonder what other people say. So I started researching, and if anybody wants to research red light therapy and not spend the amount of time I spent, there's a dude from, I think it's Australia, and it's Alex Fergus, Fergus. And in fact, he has so you want to start red light 101. You know, how do you start this process? And he goes through a lot of the safety issues. It's a 20-minute video. And every year he takes all the red light panels. He's not paid by any red light company. Every year he'll take the top 20 panels or so, and he does a comparison test, and he gets the meters out for sound on the fans, for intensity on the energy. They measure this by joules per centimeter square that lands on your skin. So does the spec of the panel have the same outcome when he's using the meters, when he's going through all of them? And platinum LED came out #1, I believe, for the last 3 years. And that's why I landed on it. It's kind of middle of the road. There's some more expensive panels, but this one has all the features, including it goes up to 1070 on, and those of you that have watched, I think we've talked about the Neuradiant red light hat that we use, it goes to 1070 so that it can penetrate the skull and about 2.5 to 3 inches into the brain.
Okay.
Safely, without heat. And so the 1070 is also part of the platinum panel, and I think they're still the only one that has incorporated that.
Okay.
And so anyway, he's just very informative. He never sticks on one panel. He goes across the plethora of panels that are out there. And if you're going to get serious, I encourage you not to buy the cheapest panel that you can find from China, which a lot of the components still probably come from China, but there is still quality control at a higher level. You can buy nicer components, and even if all the manufacturers are still buying their components here, that you can get a range of cost. And the radiance of the LED lens and how it lands on the body. You know something? People don't understand that big cluster of lights at the top of a stadium, they don't understand that each of those lights are landing on a spot on the field. They're targeted to that spot on the field. Everybody thinks, well, you just throw up a bunch of lights.
Right. No.
That's not how it works.
They adjust every bulb.
And so that's exactly how the panels work. And he shows you this, and when he does the 101, if you look up Alex Fergus and 101, just an immense amount of information in 20 minutes. And he talks about going through clothing. He talks about how it lands on the skin. He talks about a lot of things that if you don't have a lot of knowledge of red light therapy, that's a place to start.
Yeah.
And so anyway, that's what I'm going to tell people. If I start saying things that contradict what they're going to watch in that video, then I've just kind of told myself on myself I don't want to do that.
Well, this is a learning process. So what about clothes? So yes. So does it penetrate through clothes?
Well, I'll put it this way. All the red light companies say do not have sensitive skin exposed to red light therapy.
Okay.
Okay, so wear a swimsuit or wear some trunks to protect those sensitive areas. And then Alex goes through and he says start at 5 minutes.
Okay.
And build yourself up to 10 or 15 minutes. And if your panel's only so big, that 10 or 15 minutes is per side. I mean, now you're going to 10 minutes here, 10 minutes on your side, 10 minutes on your back, 10 minutes on your other side. So if you want to get a full dosage, that's how you would do it. I've got a starter set here, and what we're headed to have a wall of lights on the wall fixed, and then a wall of lights on a rack that moves back and forth. And you'll build up your dosage. And I want to build up to where you get 100% dosage in 10 or 15 minutes on 100% of your body. Right. While you're standing on a vibration plate. Oh. This whole thing is about getting your lymph going as well. I mean, the mitochondria are going to be stimulated. So what's that going to do? We have the opportunity to also stimulate our lymph. And if I'm going to stand for 10 or 15 minutes, it should be on a vibration plate. Right. If I spent X dollars on the red light therapy, why not spend another 100 on the vibration plate and kill 2 birds with one 10-minute session?
Yeah. So are you trying to tell me that my little red LED thing in my sauna probably isn't doing me much help.
Well, when you watch the video I'm talking about, I mean, you want to, and I thought we would be at 6 inches, as you know, that's maximum dosage. So everything that it says in the Platinum manual, it gives you dosages for different things,
Okay.
and it goes 8 to 24 inches.
Okay.
So you don't have to be just
have to be
right
close.
up against it. You're going to get the highest dosage, and it's all about time. The reason a farmer has one of those great big gigantic tractors with wheels over your head is so he can spend less time in the field, or he can get his work done quicker. Sometimes they just have a window of time that they have to accomplish everything, and they got a lot of property. So it's all about, if you have 4 panels, 2 front, 2 back, you're going to stand there for half the amount of time. And he's talking about a 10 or 15 minute session 3 times a week.
Okay.
And he also talks about maybe not getting in front of the panels right before bed because it'll stimulate some people.
Energy.
And a lot of people, it gives them a calming effect where they actually sleep better. So he said
I did
across
read
the-
where actually doing it during the daytime seemed to help us sleep at night.
Exactly. But
So-
but right before bed may keep you awake.
Okay.
But some people, they do it right before bed and it makes them sleep all night long. So we're all different, and
That's right.
you just play with it. And that's, you know, my whole deal is to introduce people to red light therapy. Right now, I'm not even going to, if you're a member and you're doing hyperbarics here, I'm not even charging my clientele to get introduced to it. But there's a lot of things that we could do at home if we had some understanding of it. My deal is, as you know, a lot of the things I do here is to help people at home
Right.
do these things to where it's easy. Why drive to a clinic, you know, and have to spend time at a clinic when we could do this of the evening when we get home and make our health better?
And we have to do it often enough too. So, you know.
Yeah, I was surprised. He was talking about 3 to 4
Yeah.
times a week being, you know, a full dose. And if you go beyond that, you know, there's a diminishing returns situation. If you go beyond that, you're past that point of diminishing returns.
Yeah. So twice as much is not always twice as good.
Now, Brad, I hope you're listening.
So. so.
O2 drop.
So.
Yeah.
So what? So you mentioned this distance. So like, you know. So,
Again, the way that they measure that is joules, which is an
Okay.
electronic, you know, joules, how many joules?
Right.
Well, that's the energy, and how much of that energy is landing on per centimeter square of your skin.
Okay.
And again, like the football field, the better panels are going to land that energy spaced out, as if you were that light on a football stadium looking at an individual spot on the field.
Okay.
So it's not a cluster of light that's concentrated, you know, in any one spot like a cold laser would be, but it's individually. You want to get good broad coverage that's the same everywhere it lands on your skin. You don't want a hot spot, and you want all of your skin to get that therapy.
Right. Okay.
So-
I forgot to mention also. So whenever you are, those of you that are watching, if you have a question, go ahead and submit that. So Betty's going to help us with those questions and submit those questions to us. It's hard for me to see the screen this far away, and so if you have questions about red light therapy or even some other things, I'm happy to answer that.
I sent that, Betty. I think Betty's going to post that YouTube. Will it be on our Facebook Live? So she's going to post the link to the Fergus 101 red light that I was talking about.
Okay.
Really interesting video to watch.
So this person he's an independent. You know,
Yeah, he's-
this, you know,
And if you buy your panels from him, he makes a little bit, like I do,
commission
off of them. I hope you'll buy them from me and not from Fergus. But he is a wealth of information, and so support all of us however you can. But he's made this his business, and he's been very successful at it. And as you talked about a second ago, we're just talking about panels at this point.
Right.
Man, they make, and he covers a lot of different kinds. We got a red light helmet that we use, but there's the wraps that you put around a joint
Yes.
that's inflamed. There's, my wife has macular degeneration she's dealing with, or she's trying to cut it off at the pass. She's got special glasses that came from Great Britain that a doctor's been studying it for a long time, and they're not very expensive. and they're the exact wavelength that will penetrate the eyelid and give you good dosage. And you only wear them for like 2 or 3 minutes a day.
Right.
And so it's, again, you don't do these things for an hour.
Right.
They're short term. You get that boost from that mitochondria or whatever it is you're dealing with. They're talking about the oils in the back of the eye, that the red light therapy will change that. I don't know if it's a viscosity, but it's working on the oils at the back of the retina. And so there's all kinds of red. You've seen the mask that you wrap around your face. The red light helmet, I have some of my clients that bought it for cognitive decline. Their wife, and you have a 90-day period to use it, you can turn it back in. And I've had the wives go, you're not getting the helmet back. I don't care what hubby says. And what are you talking about? Because they're laying in a recliner and putting the helmet over their face. And it's absolutely changing their facial, the collagen in their face, making it tighter and more supple. And I mean, I probably had 3 or 4 women tell me that exact story, that they're just getting that kind of benefit out of putting the helmet over their face.
So what about cognitive things? So how is that working out?
Oh, it is awesome. So we've sold probably, the helmets are expensive, and you do it in tandem with what we call brain mapping.
Okay.
That's a QEEG. So you take the QEEG, that gives us a brain map. It tells us where the brain's hot, and it tells us the different alpha, beta, theta, delta, gamma. So it tells us where all that lines up in our brain, and now we want to alter it and balance the brain. So that helmet I'm talking about, they take the brain map and they program 4 different regions on the brain. Because again, going back to stimulating your mitochondria, you don't want to stimulate a good part of the brain.
Right.
When there's a deficit on the other side, you want to target that with more energy. And you want to end up balancing the brain. So you don't want to just flip a switch and charge your whole head when you have the ability to balance it and treat it accordingly to balance out that and it's been awesome. We've sold 22 of the helmets. They have a 90-day policy where you can return it and get 80% of your money back. And I've had one person call me back and say that they were going to turn it in, and they haven't yet.
They didn't do it.
So
how about that?
So we're having really good success with it.
That's good. We're being blessed with the research that's allowing these newer therapies to come out and to learn and to share that information. So it's great information. So we have the handout and more information. So I do have a blog post about cancer and red light therapy at prevailovercancer.com. At the bottom of the Learning Center on my website also is a handout with just a very brief notes on that, but the blog post does have a lot more information about that. So let's see,
I'll throw one more thing.
yes.
Betty, if we got any questions? Okay, so we're ready. So one other thing, that my clients will come in and they'll have a non-healing diabetic foot wound, they'll have a rash, they'll have some eczema they need to deal with. So I bought it's a Hoogla, Hoogla, I believe, and it's a little 12 by 18 inch panel that you set up like a book stand. And so I'll loan it out to my clients that come in. They come in for hyperbarics, and I go, why don't you try this at the same time you're doing hyperbarics with me? And I let them rent it. They don't even rent it. They loan it out. We have a little library checkout system in here, books and red light therapy. But they'll take it home, and it really is to spend $100 and a quarter, and to have a light like that you can literally rig it up. You can use it. You can put it on the kitchen counter for your face. Women love that. And it's $125, and it's just amazing what it'll do for you.
Okay.
So
great.
Anyway,
great information. So
Betty's got some questions
Betty's
coming.
going to get a sheet.
Anybody here have a question?
Yeah. Any questions?
So we got a red light bed owner right back here. They just bought a $50,000 red light bed, and so up by Guthrie, they're going to start offering red light therapy.
Can you speak to how red light might penetrate through bone, like the skull?
Well, there's all kinds of, so that's what I was talking about, the 1070, the Neuradiant hat that we use. It's 1070. It doesn't have all the other range, it's just 1070, and it will penetrate the skull in 2.5 to 3 inches into the brain. because of that wavelength. The lower you go in that number, the thinner it's going to penetrate through your epidermis, muscle tissue, whatever. So yeah, 1070 is deep penetrating.
Okay. So this one's going to be for you. Okay. So the more I use the red hat helmet, the more my head itches. It's always near the end of my session. Is itching a good thing or a bad thing, and why?
Number one, I've never heard that. But what I will say is when I have a wound, when I have something, an irritant on my skin, and it's healing,
Itchy.
it itches.
Right, that's right.
So I don't know if you're dealing with anything, if this is on your scalp, there may be something on your scalp that is creating a healing and it's making your scalp itch. So any kind of dandruff or eczema or any of those things you might pay attention to or see if you are dealing with any of that, but that would be my only thing that that I can think of.
The other thing I would think about would be that chemical exposure, and
Yeah,
so
what
hair products.
Yeah, what hair products are you using?
Exactly. I think that could be a potential issue.
Yeah, I use an organic hair product for all those same reasons, but I used Head and Shoulders when I was younger all the time, not to call out somebody,
So
but
did I.
I think it's important to ask her. She does have dandruff.
Yeah.
so
Can she answer? Whoever asked?
So yeah, I'm not sure who that was, but if the person that asked
So
that
you-
question, if you let us know if you have an issue with dandruff or
and I would like to know the
hair
helmet
products.
because sometimes the red light causes, you know that word? I'm
So
sorry.
the red light causes somnolescence by action in the mitochondria. So we're talking about drowsiness, and so I think they're trying to ask, does it cause drowsiness or kind of like a restfulness by acting on the mitochondria? If anything, it's actually a little bit more stimulating, in the body. And so, because the mitochondria makes energy. And although it depends on which mitochondria we're activating, what part of the body and the brain, it still may even have some calming type action too. So if we have enough energy, matter of fact, I notice this actually with my clients. If clients that come to me with anxiety, when we address their underlying energy issues and actually often adrenal issues, and they have more energy, now they're not as anxious. So there's sometimes some other things going on.
When they're not as anxious, what I see a lot of times with my veteran community especially is when they're not as anxious, they get tired. They're not on that high alert. All of a sudden they're in a relaxed state, and it's not uncommon for those kinds of individuals in the chamber to get so relaxed they go to sleep.
Right.
And it's because they're used to operating at this high alert level, and all of a sudden they don't have to.
Right.
So
Okay. So how many times a week and how long do you recommend for cancer patients? Well, so we're talking, I would actually be going with more like starting off with just a few minutes at a time, but I'd be doing it like 5 days a week, and maybe even more, but we can't always do things every day. And so like I do a sauna 5 days a week. I could do it more often, but there's always going to be something that's going to happen. And so there's going to be some days I can't do it, and that takes away some of the pressure off of me, so I don't get frustrated with that. But the goal would be to gradually increasing
It
that.
depends what stage are you. If
Sure.
you're stage 4, you should be doing it every day.
Yeah, exactly.
If you're
So
just maintaining, every other day is fine, or 2 times a
the
week.
more
That's
more
what I was gonna-
If I
serious.
have glioblastoma, I would live inside of it.
Yeah, so the more serious a health concern
Yeah.
or cancer, the more frequent, the longer the time
Yeah.
period, cautiously and being wise, and extending those times.
yeah, what you're going to see on Fergus when you're watching that is he's talking about people doing a maintenance situation. If you're acute, if you're doing something that you're in trouble, then you're going to ramp everything up a little bit more.
So another question, and do you recommend or use CDS, chlorine dioxide, to treat cancer patients for oxygenation? So there is definitely some research showing some benefits for that. And so definitely there's a lot of people that use that. That's not my first line. There's often many other things I will go into first for that. Is resveratrol in the pathway products? Yes, resveratrol that I mentioned is actually in pathway 4. and it has ECG, resveratrol, fisetin, and beta-glucans, in that pathway 4. And another person said, I'd gotten a red light brush to try to grow hair. Can I use it for other things? And so definitely. And although it's small, probably if it's a brush, it's a small one, but definitely. So, matter of fact, at a compounding pharmacy that I used to work at, well, actually, they're looking at red light therapies, to grow hair and to help stimulate that growth, get that mitochondria going, along with drug therapies to help penetrate those things and to get that in. Of course, that's where the doctors and pharmacists are concentrated on, are going to be drug therapies. But microneedling, red light therapy, and drugs trying to get the hair follicle to recover.
When I was talking about the women using it on their face, well, that was after we already had the conversation about how their hair has gone crazy. And that's what moved it to their, I mean, the hair, everybody that has that helmet cannot believe how much stimulation their hair gets and how much growth it gets.
Okay.
In fact, I've got an employee here that said, my hair doesn't grow. And she started using the helmet and the hair started growing.
Yeah.
I mean, big time.
Yeah.
She was
Good.
really blown away that it stimulates it that much.
Yeah. So
What if that's Sharon?
I could probably answer that, no.
So red light therapy, is a concentrated form of a natural treatment, because these waves are also available from the sun, these light waves, and so in this case we're concentrating them, for use, on the body and in the body. So I think that's about it. So unless anybody else has any other questions, a question, yes.
It's not related to this, but
Okay.
can you teach me a little bit about CD133 pathway? Do you know what that is, or have you heard of it?
Well, I'm not that familiar with it.
Okay.
Yeah,
I'm not either, that's why I was
right.
asking.
There's many different pathways.
Yeah.
Growth and inhibition pathways, and so certain cancers can have certain ones.
From the other name, because that's what it is, but it targets stem cells.
Okay.
We've talked about this
Yeah,
before, I think.
okay.
What do you know about that?
Like for stem cells,
Cancer stem cells.
cancer stem cells are kind of like, in a way, sleeper cells. They're not very active, and they are cancer stem cells are resistant to other treatments because they're kind of like, in a way, if you want to think of it, asleep, or they're not very active, and therefore they're not taking in those nutrients or the chemicals or the radiation, and they're just kind of sleeping there and kind of resting, and then whenever
So they're not the first attacking cells.
no, they're not the cancer cells yet.
Okay.
But
They're waiting for the
but they're a stem cell, and that means when they come out, they actually morph and go into the cancer, turn into the cancer. Okay, so we do want to try to address those, and that's the challenge.
Before they turn.
Exactly. So and that's what comes back to actually a lot of natural products, and like resveratrol, green tree, green tea, matcha, clove. Clove oil and matcha and sulforaphane. So many natural products actually help address that cancer stem cell issue, and often can be taken with other treatments.
Because I think people, even on remission, they should always be on the pathway like Nate, because that pathway should address those stem cells from turning into cancer.
That's correct. And so matter of fact, I had a client yesterday. She has a reoccurrence, or actually a second or third round. I just met her yesterday, of breast cancer, but this is a different type of cancer. It's a different type of breast cancer. And so there's something about inside her body, the environment inside her body, some people call that the terrain, is allowing that to happen. And so what we're going to be doing is trying to assess what's going on in her body to keep that and or stem cells from morphine, coming back out and ready to grow
I would
into
go
it.
as far as that's something outside of her environment. It's not inside. It's outside.
Correct. It's outside, that's in her body. Yes,
Yeah.
that's correct. It could be exactly environmental,
She's being exposed.
something
That's
about
why
her
it comes
body.
back.
We're going to look at her hormone metabolites, that people haven't done that yet. Her 2, 4, 16 hydroxyestrogens in her case. So that our body makes not just estrogens, but metabolites, and some of those metabolites are cancer causing. And that's, yes, T.
Going back to red light therapy and something you mentioned earlier about some people it energizes, some people it helps them get to sleep. Studies that my wife has done has found that, you know, earlier hominids would wake up with the sun, have bright sun all day. At night they would have the fire, and then they would an orange glow or red glow, and then they would go to sleep. So we've gotten in the habit of using it at night before we go to bed, and found out that it really does help us calm down and help us get a better sleep pattern going.
Mm-hmm.
Cool.
As long as we don't walk through any rooms with bright lights after
Yes,
we leave.
right. Like part of that nighttime routine. So that's where we will often, you know, do that. So you turn off the lights and make the room as dark as possible. I don't brush my teeth, wash my face immediately before bedtime. That stuff's taken care of. So when it's time for me to go to bed, I just go to bed.
You said turn off the lights. You remember Dandy Don? Turn off the lights. The party's over. So anyway, we are done with this week's segment. Okay. Sorry, I hope y'all can handle that. But anyway, thank you, Keith. As always, a pleasure. We always learn so much. PrevailOverCancer.com.
And Hyperbarics.plus.
And this is Hyperbarics.plus. And if you get wild hairs for some red lights, I think we got a link from Platinum to from our site that you can buy panels.
When are we gonna start?
And so everybody sitting here is going, when are we going to start? As soon as you sign the waiver. So anyway, we're going to get started here, and here in a couple of weeks we'll give you some feedback what people are saying about red light therapy. I don't know what we have on tap for next week. Any ideas?
I don't know either.
So you all have any ideas that you want